A groundbreaking Oz. You don't have to live in agony anymore. Heal your chronic pain. No pills, no surgery.
Today, we are changing the practice of medicine.
The new invisible treatment your doctor hasn't heard of.
It builds a magnetic field around you, going deep into your body.
Is this the revolutionary cure you've been waiting for?
Are these things for real?
This is new cutting-edge research.
Dr. Oz investigates.
This is how we're going to change medicine together.
Unbelievably successful. I was suffering from back pain. Within less than 30 minutes, I had total relief. Just purchased a machine.
Just had a bad back, and I sat down on the QRS mat and feel great. My back that's been bothering me, hips are always bothering me forever, 30 years or so, and I feel great. It works wonders.
From 10 to a what?
0. I feel nothing.
No pain.
No back pain whatsoever.
And what have you done for it before?
Massage, acupressure, not puncture. Pretty much anything possible. Baths, things like that.
How does this compare?
It blows them away.
Seriously?
Seriously. I was on there for
an hour?
Yeah, I was on there for about an hour.
So nothing you've ever done competes?
No. It's always been temporary.
From degenerative disc disease, have for about 15 years. I was using the
QRS
today for about 30 minutes. After that 30 minutes, I would have to say let's say before I had about a pain level of an 8 that's constant. I've just learned to deal with that. And after that, I'd have to say it was down to a 2. I got up off the floor, no problem at all, and have been doing well since.
Optional frequency therapy from a chosen area of the brain spectrum calms the patient's mental state into a relaxing alpha rhythm.
I think I did 30 minutes on that, right? So it was awesome. I was all bound up in my upper body. I fell asleep in a chair last night, and I felt like I was frozen, like I didn't want to move, and because I was concerned about the pain. But I've got no muscle movement issue at all. I feel great. It's awesome, and it loosened up my lower back too. I've been standing at this conference for better part of 5 hours, and I was sore and stiff in my whole body. So I feel wonderful now.
QRS mat, and on there for about a half an hour. I had some low back pain, a little bit of abdominal pain with it, and I don't have any more pain now.
QRS for an hour, and I have no lower back pain from a compressed L1, no pain, and crushed C2, C3, and 2 shoulder surgeries. I'm doing just fine. So the hour work.
And how about your free radicals? Where did they go from?
Free radicals dropped 5% from 502 to 459 after just an hour on the bed.
Within 10 minutes, walking away, I felt an extreme difference in the pain that I had in my back. It was relaxed. I knew something had really changed that quick, just in the 10-minute of use. It's really got me now where I know I'm a believer.
I was on the QRS, sat down for 30 minutes, had screaming heel pain when I did, bone spur. I got up, hey, feels great. Nance. Try it, you'll like it.
It's the athletes that come back to me. They're the ones who respond so well to the QRS. And in research, I found out that the QRS system is an E-function system. It's a signal that's specific to the QRS system, and that seems to be what gets these kids better. Just what it does is it opens up the cell membrane so that the cell heals faster, and the results are dramatic. It's just hard to tell you how quickly these kids have healed. I've had a kid who came in with major 2 ligament sprains of his ankle, grade 2. He had an MRI done. He was an all-state basketball player, first game, and after 4 days of using the QRS, he was able to play basketball again, where they were going to sit him for 4 weeks. So dramatic results. The orthopedic surgeon couldn't even believe that.
I had a shoulder injury. I was on the mat, and a few hours later, and I just feel great. My shoulder doesn't hurt at all. and that's a miracle.
I was using the QRS for about a half an hour because I have neuropathy, especially in my foot from surgery, and I do feel less numbness. And I actually, as I was using it, I was feeling pain in my toes, but now that's gone, and I could feel the energy going up my legs as well.
Oh my God. I just ran 6 miles and my left hip flexor was really sore and tight. QRS, I laid down on the QRS and my hip flexor is all better. It's not, that's crazy. I'm not kidding.
And that was only 30 minutes.
I'm Zach Harris. I currently play football at University of San Diego, and I had surgery on my femur for an osteochondroma. I used the QRS system, and it completely took away all the tenderness from the area, and it also broke it up, so more range of flexibility, and virtually have no pain afterwards after the procedure. The treatment definitely depleted a lot of the scar tissue around there and the tenderness, and I was on it for about an hour and virtually no pain afterwards.
And as for QRS, after lifelong chronic inflammation of my eyes, I always looked like I was just severely drugged or on drugs with deep red eyes. Within days on the QRS, that was healed. And also chronic lower back pain and digestive problems went away within 2 weeks. Unfortunately, I then went away and did not have an opportunity to take the system with me, and I cannot wait to get back on it because some of the symptoms have recurred. So I'm really anxious to get onto that QRS system again as quickly as possible. Also noticed just a feeling of being uplifted, feeling lighter and brighter, and regenerated after just 8 to 16 minutes on the QRS. So no longer needed 2-hour naps in the afternoon, 8 minutes on the QRS, and I was ready to go. So go for it, and don't leave home without it. When you travel, take it with you.
A day ago, I had spinal stenosis done, where my vertebrae also in 3 discs, were actually cut. Some of the bone was cut off and some of the fat was taken out as well. And they went 6 inches up and 3 inches down into stenosis, almost like rotor-rootering is what he called it. And I've been in pain severely, okay? So I came here and I saw this incredible, I can't remember the name of it now.
QRS.
Yeah.
QRS.
And so I lied down for, I think it was 45 minutes, and I got off and I'm doing this, and that's the surgery.
Wow.
And normally I'm taking one of these little guys every 2 hours because of the pain, and I haven't had one for an hour before I got on this. I don't really have any pain back here. I mean, look at this. This is nuts. I'm doing salsa. Yeah, I'm doing salsa here. I shouldn't overdo it, I know it, but you know, the pain is actually, I would say, more than 70% gone right now. Wow, it's absolutely amazing. Absolutely amazing. You guys are the real deal, so that's phenomenal.
Guys, I'm Dr. Michael Freud from Comprehensive Care in Northwest Indiana. I'm an osteopathic practitioner who does nothing but injury care. We take care of workman's injury, private injury, take care of municipalities and state agencies and federal agencies and all kinds of nice folks who come to us with issue. I had one of the company owners, one of a large construction company, asked me to see his mother who had tripped in her own home and had taken a fall, and she had just been placed into a rehabilitative institute locally. And she had gone through a number of physicians, inclusive of orthopods, neurologists, rehab physicians. She was left with inability to stand and weight bear, especially right side, and had pain into the buttocks region and into her pelvis. So I gave her a QRS system that I had been provided with, and I had her sit on the intensified pad on a daily basis, and she told me that she sat on it throughout the day. She had her only pain relief while sitting on the QRS system. Within less than a month's time, 2 to 3 weeks maybe, she was up and around walking, and she didn't want to give me back the system. She appreciated it so much that she asked me if she could keep it even beyond her ability to stand because she still had a little bit of an ache. She kept it. She brought in a lovely gift for me when she returned it, and she said, I don't know what it does, but it helped diminish the pain, where she now was able to get into her own little pool that her son had provided her with, that she was using on a daily basis before her trip and fall, and she never thought that she'd be able to climb in and out of it again under her own strength. I can't tell you, I can't be more thrilled with the outcome. I just can't wait for somebody to maybe give these things a stamp of approval so that we'll have a further ability to use them for our patient care. That was my 83-year-old, but I continue to have the cases that give us our greatest challenge. I continue to try to use the device on them. And she ended up having this individual side knee replacement surgery and had a foot drop following a little bit of a traumatizing of the nerve, and they had her on all your gabapentins, they had her in therapy. She even tried acupuncture to no success, and she wasn't able to drive. She had very limited ability to walk. She was already wearing a assisted device for her foot, and I asked her to give the QRS system a try, and she religiously used it every day and returned it to us after about 6 weeks of use. And she drove here without her husband's help, and she walked in without gait imbalance, and she had no further foot drop, and it was the only device that significantly changed her outcome. And because of it, it's one of the things I continue to believe in my cases that have these vague challenges that you don't have a direct way of isolating or improving the outcome. The system seems to do a fabulous job, and I'm going to continue to use it despite the fact that I can't bill for the damn thing. I'm going to give it to the patients that want to have the improvement and are willing to try it. I use it myself. I've used it on elderly. I've used it now on this young lady, and I'm going to continue to use it in every case I can. So I can't tell you enough. I endorse this system. I always am a second-generation osteopathic physician, and we're always trying to find a better way to improve the outcome of our patients. I can't tell you enough thank you. Appreciate it very much.
Now, just to be clear, we are not talking about static magnets like the kind you stick on the fridge. This is pulsed electromagnetic fields. It's pulsing, moving energy, much more powerful than static magnets. So here's how it could work for your patients. All right, so this is really important. I want you to understand it well. Here's what researchers say magnetic fields are doing inside the body. Inside this mat, there are electrical coils. And when electricity passes through there, it creates a magnetic field that moves through the body. And it whispers. There's 75 trillion cells in your body. And it goes deep into your body, places where sports screens and heating pads could never reach. For example, down around the spine, where that red, angry area is. Now, the magnetic field turns on, and when it does it, it activates these ions, these charged particles, and there are proteins in there, and there's signals in there, stirs these things up, and these charged particles bring in nutrients, but they also begin to influence things like blood supply. Now, when the blood vessels are going in here, the red blood cells are actually stacked. See, they're stacked like that. They're not supposed to be stacked. When they're irritated, that happens. So when you pass magnetic fields through there, that yellow line, it opens up the blood vessel. It breaks apart these red cells. They're not stacked like coins, so you can get deep healing, better oxygen supply, so the healing process takes place. You don't just feel better, you are better. And that's an important advance for us, one that we haven't been really practicing until today, because today we're going to change the deal. Some of the studies have been done with these whole body mats that I showed in that animation, and I've got one over here. Let's run over here, I'll show this to you. So these devices are pretty straightforward. There are many different ways you can get moving electromagnetic pulses.